Hello, good evening, everyone. Hope I'm audible and you're able to see me. Visual, right? Okay, so I'm Dr. Rohini and you are watching Unacademy classes. And today we are going to discuss next topic on general anatomy. So here will be general anatomy topic. We are going to discuss some movements. What are the movements that you can do with the various muscles, various joints, and combined together, what sort of movements and what is the name of those movements? That is what we are going to talk about. Okay, so here we have some students eagerly waiting, and here we have started. Sorry for the delay. And yeah, so if you message, I will know who it is and I'll be able to read out your names. So since I don't see the message, I don't know who is exactly watching me. So whom we have here today? Okay, so let's see. All right. So here it is. I have some of my credentials. I have MD from KMC Mangalore, Karnataka, and PhD from Savita University, and also MT and MBA from Georgia, USA. So these are the credentials. You want to read more about me and want to know more about me, then please visit my profile. You can visit it by using this username, RoAqua. Okay, or also you can use this in the search tool, Dr. Rohini, and by visiting the website, that is www.unacademy.com, you can go to my profile. I'm under NEET PG section. Okay, I teach anatomy exclusively for NEET PG students. And you know that anatomy is a subject which is there for each and every one who steps into medical field. Okay, be it a pharmacist, be it a nursing student, or a dental, medical, or even when you go to PG level, the anatomy is not going to leave your back. Okay, it's always there with you. Without the basics of anatomy, there is no doctor. All right, so you have to know anatomy. Without the anatomy knowledge and without the thorough knowledge of anatomy, it is very, very difficult to understand the subject. Okay, so here you need anatomy educators and definitely you need a lot of knowledge in anatomy. Okay, let's go to the subject. So here we have subject, we have subtopic general anatomy. Let's go to the general anatomy, what we are going to see today. And okay, so here we have more of the information. We'll talk about some of the movements. You know that movements are produced by the joints, right? What is a joint, first of all? The junction between two or more bones. Junction between two or more bones, you call it as joint. You need at least two bones to form a joint. Single bone will not form a joint. You need at least two bones to form a joint. Sometimes it is two bones or more than two bones. For example, elbow, you have more than two bones. So there is many joints. There are many joints which have more than two bones that form the joints. So here are some of the movements at the joints. You can do flexion. So remember the fair part of your body. So you remember this way. That is an easy method to remember. Fairer part of your body. Look at your own self. Fairer part of your body will flex. Okay. So F for F. So fairer part of your body will do the flexion. So you can see in front of your body where you have the fairer portion. So this is the darker portion. Thighs, you have darker portion. Back is the fairer portion, right? So here you can bend. And even at the back, see here, you can bend, okay? You can bend at the knee joint. Backwards, you can bend here. But front, you cannot bend. You can only extend. And similarly, here in the front, in near the elbow, it is fairer. This is the fairer region. So you can bend here. That means you can flex. So remember, flexion happens at the fairer side of your body. So flexion. What about extension? Extension is on the opposite side. So opposite side of the flexion is extension. So for example, the back side of your elbow will be extension And also front side of your knee, this is extension. And back side here is flexion. Okay. So when you reduce the angle, then you call it as flexion. When you increase the angle between the two bones, call it as extension. So that is the definition of flexion and extension, reducing the angle and increasing the angle. What is hyperextension? When you extend beyond its limit, then you call hyperextension. So sometimes hyperextension can also lead to dislocation of the joint, may also lead to dislocation. So dislocations usually happen because of hyperextension. So it is always true, right? Whenever you try to do things beyond your limit, the things go wrong. So here also beyond your limit, when you try to extend, that is hyperextension, it can go wrong. It can lead to dislocation. Okay, so that is one thing. Next, you have adduction. You see here add is there, right? Add is there. What is that? Bringing them together. What do you do by adding? You put them together. So that is adduction. Bring the body parts close to the midline. That is adduction. When you hear the word abduction, you must have heard this word many a times. Somebody got abducted. So somebody was in Kashmir, they got abducted. They were abducted to some other place. So what is that abduction? Abduction is purely taken away. It is taken away. So taken away means abduction. So this also means that you're moving away from the midline. Away from the midline is abduction. Okay, so you have to have a midline to define adduction and abduction. So otherwise it will become just a deviation, medial and lateral deviation it will be. So you have to have a midline to define the adduction and the abduction. Okay, so you also have pronation and supination. What are these two? Pronation, remember P. I would just, always tell my students, remember P for pillow. Okay, remember P for pillow. Very simple. And supination, you remember sun. Okay, you look at the sun. You can sleep at the beach. Look at the sun. That is supination. Or you face your palm towards the sun. That is supination. You do the P. That is pillow. Your face is facing downwards. That is facing the pillow. It is pronation. Or you can also make this as promise. You're using the hand, promise. So with what joints you can do supination and pronation? You can do with the body, you can do, or you can also do with the palm. Palm you can do pronation, supination. So this is supination. The opposite is promise is pronation. Okay. So these are the two terms you have to learn. Then you have retraction. Re is always, backwards. Rebound, redo is always something that you repeat or backwards. So this will exactly tell you rebound or retract. Rehearsal is what? Something that, you repeat and do, or you do again and again, or you do in the opposite direction, something like that. So retraction is, backwards, pull them backwards. Protraction is forward. So with the jaw, we can do forward protraction and we can also do retraction. When you are not doing anything, that itself is a retraction. So when you are just calmly sitting with your jaw not moving at all, that is traction. When you do the jaw, lower jaw forward, you know that only the lower jaw moves, right? The maxilla will not move. The frontal will not move. The only thing that moves is the lower jaw. That's why it looks as if the entire face is moving. It's only the lower jaw that moves. So when you move the lower jaw or the mandible forward, that is protraction. So protraction happens in which one? It happens in mandible. Example, mandible you can give. Okay, this is an example. And is there anyone who has any questions? All right. Murli, what is it? Tortoise? Tortoise for what? Protraction, retraction, tortoise. Yeah, tortoise also can do supination and pronation. That's one thing I can talk. Okay, so, all right. Who else is messaging me? Let me read out your queries or questions or comments. Next, we have depression and elevation. So, elevation is go upwards, pull it upwards, elevate. Depression is down. Remember D for down. Okay, D for down. That is depression. So, this is depression. This is elevation. Rotation is going round and round and round. That is rotation. Then we have circumduction. Circumduction, the point is here, but the action is happening here. So that is circumduction. But rotation, it happens at the axis. It happens at the axis. That's the difference between these two. This, the point is here, but the action is happening at a farther end. Okay. So this is circumduction. Next, you have external rotation. External rotation is outward rotation. External is outward rotation. You can turn your palm outward like Bharatanatyam dancers. You can turn your palm outwards. You can turn it inwards. So outward is external rotation. Inwards is internal rotation. So outward, inward. Okay. Next, what is inversion? Inversion and aversion. This you can do with the foot. Aversion is also done with the foot. Aversion is E, outwards. Sole facing each other. Small kids do this. Small babies sit like this with the inverted foot facing each other. The outward facing is aversion. Inward facing is inversion. So remember, in is inside. Inside facing, outside facing. Next, what else we have? Any other people who? Rajesh, hey Rajesh, good evening. Nice to see you. Next, we have dorsiflexion and plantar flexion. What is dorsiflexion? Dorsi is this one. Lifting your foot upwards. We don't have that particular picture. If this is lifted upwards, is dorsiflexion. Dorsiflex. If it is pointing downwards, then it is plantar flexion. Okay. Then we have radial deviation and we have ulnar deviation. Radial deviation is, this is radial side. If you deviate this side, it is radial deviation. If you deviate your hand towards the other side, it's ulnar side. The little finger side is ulnar. This is radial. Remember, towards you is ulnar. Towards you is ulnar. Okay. Towards you is always ulnar. Richa, hi Richa, good evening. Nice to see you again. I remember you were in my last class also. It's nice to see you again. All right, next one, let's see the movements. We have flexion, extension, hyperextension also. So here I told you flexion is on the fairer side. Remember, fairer side. Bending a joint or decreasing the angle between the two bones is flexion. Okay, this is flexion. And you do the opposite. You keep it straight. This is extension. So this is extension. This is flexion. Okay. So this one, straightening a joint or increasing the angle between the two bones is extension. Then what is hyperextension? When you overdo it, excessive extension is beyond the anatomical position. So that is hyperextension. It can lead to what? It can lead to dislocation also. Next, you have all these terms defined with the angle here. So here we have wrist flexion. Okay, so you bring it closer, then it becomes a flexion. When you keep it straight, it becomes extension. When you move it above, beyond its anatomical position, then it becomes hyperextension. So you have all the three explained in one single diagram. Okay, so here we have, let's see, All right. So here we have knee also we have flexion, extension. This is extension. This is flexion. And then you can also do, you cannot do hyperextension actually. It's very, very, limited and it is not possible easily. Hyperextension is not easily possible because of the other limitations. You also have patella, small bone here that's called patella that limits the hyperextension. And elbow, you can do flexion, extension. Okay, flexion and extension. Hyperextension is not possible easily. Next, you have other movements. Like I said, adduction you have, bringing it close to your body. So this one is coming close to body, right? So that is called adding, adduction. When you are taking it away, so you are taking the arms away from your body, that becomes abducting, taking them away. That is abduction. Then you also have two movements when it comes to the palm. Okay, only with the upper limb, not with the lower limb. You can do pronation and supination. With the pronation and supination you can do. So here also they have shown, but this is really, really not quite possible. So you can do very easily with the palm. You can do pronation. You remember I said for P, promise. You promise somebody something like this, that is pronation. You turn the arm or foot upwards like this, then it becomes supination because it is facing upwards. So down is pronation, up is supination. Remember this, I said, remember the sun, facing sun. Okay, next we have, and which joint will do this? Now let's talk about what joint will do pronation and supination. You have radio-ulnar joint. So here we have the radius. This is called the radius and this is called the ulna. And it has a joint here. This is called the distal radio-ulnar joint or radio-ulnar joint. And this is called the proximal radio-ulnar joint. Distal radio-ulnar joint, proximal radio-ulnar joint. So it happens at these joints. These joints will help in pronation and supination. Okay. Similarly, you also have pronated foot, neutral foot like this, and supinated foot. Okay. When it is facing like that, it will be supinated. Laterally is supinated. Medially turned is pronated. Okay. This is not given much importance because it's very difficult to gauge exactly in what position the foot is, because there is always limitations with the foot. Next, see what are the movements that we can do with the head. With the head, we can do many movements. We have some, movements with the jaw. This is the jaw. This is jaw. Okay, which is formed by, this is lower jaw, which is exclusively mandible bone. So here we have, it is retracted. This is protruded. Retraction, bringing it backwards or normal position. This is protrusion. And then we also have elevation, going upwards is elevated. You open your mouth. So this is open mouth. This is closed mouth. Closed mouth. That is elevation. Okay. Next you have open mouth. That is called depression. So depression is open mouth, elevation is closed mouth. Which, muscles do this? These are done by a set of muscles called muscles of mastication. Mastication. So why I broke this? Mastication means chewing. Chewing the food is mastication. The process is called mastication. Okay, so Murli, I'll be giving advanced classes also. We are going to, because the NEET PG just, got over. We are starting with the basics and then we are going to go with the advanced classes. Okay, I'll be including some, pathology pearls also in the classes. So you please look forward for all those classes. And in a week or two, we'll be, jumping to the advanced classes. So here, just 1 or 2 weeks, we are going to be the general anatomy. All right, Murli. And then you can definitely catch up with me with the advanced classes because I need students who are very interactive like you in the classes. Okay, so this is elevation, depression, protrusion, retraction. Okay, muscles of mastication. Which are the muscles we have? Temporalis. Then we have buccinator. Then we have masseter. Then we have medial pterygoid, lateral pterygoid. So these are the muscles which do all these actions. Which muscle does which action? We'll go to the detail and we will study. Okay. Next, we have some movements with the scapula. Not many people know the scapula movements. Okay. So here the scapula is very important bone at the back. It does lot of movement. So here we do the shrugging of the shoulders, right? And we don't know some answer. What do? We just say, I don't know. This is the movement. I don't know. So shrugging is not just done by the scapula bone, but it needs the muscle which helps it. That is trapezius. So trapezius muscle helps in shrugging the shoulders. Shrug is the action. Okay. It's not just going to do the shrug, but it will also do elevation and it will also do depression and it will also do retraction of the scapula. Retraction of the scapula. So these are the movements done by the trapezius. Okay. So trapezius has upper fibers, middle fibers, and the lower fibers. So all these muscle fibers, they are involved in different activities. So there is elevation done by upper fibers. There are middle fibers which do the retraction, and there are lower fibers which do the depression. So here is elevation. Okay. Shrugging helps in elevation of the scapula. Then we have depression of the scapula. Then we have adduction, which is also called retraction. Then we have abduction, which is also called protraction of the scapula. And sometimes abduction, when it does, protraction can also lead to a condition, winging of scapula. When the muscles are not rotating and they're just protracted all the time, then that is known as winging of scapula. This is upward rotation, that is overhead abduction. You can also lift your arm upwards by rotation. It is called overhead abduction. Okay, so medial border, this is the medial border. This will rotate. This will go in this direction so that you can lift your arm upwards. And then there is also downward rotation. There is also downward rotation that is returning back to the anatomical position. So all these are the movements of the scapula. When you have someone who is really skinny and thin, you should ask them to stand and demonstrate all this, the movements of the scapula. It's very nice when you place your palm on the scapula and feel the movement of the scapula. You can ask him to do elevation, depression, retraction, protrusion, and the rotation. Okay, so all this has to be demonstrated and learned. All right, so what else we have? We have some of the muscles that do this action. We have elevation. Let's see. Elevation is done by which one? So here there is trapezius and levator scapulae. See, levator, elevator. What is elevator? Takes you up, no? So elevation is levator. The depression is bringing it downwards. That obviously will be lower fibers of trapezius. Then retraction, remember retraction is adduction. I told you it is the middle fibers of the trapezius along with the rhomboids. Then we have protraction that is done by serratus anterior. It is also called overhead abduction. Overhead abduction. Okay. Then we have upward rotation. Upward rotation is middle and the upper trapezius fibers. Then we have downward rotation, which is done by rhomboids. So remember the names of all these, muscles. It's very, very important you remember the names. All right. Is there any questions from anyone? All right. Next, let's see what else we have. We have some movements. This is the rotation. Okay, this is how you can rotate the head, because we have rotatory movements done by the cervical vertebrae. We have C1, okay, C2, which do the rotation. Okay, we have a process called on the C2, that is axis. You have a process called odontoid process. Okay, so that like a peg, it just rotates around the peg. So that is rotatory movement. Along a single axis it happens. You can turn right, left. You cannot make a complete rotation. It's only a single axis. Then you have circumduction. Okay, circumduction you can do with the palm. Triplanar, circular motion at the hip or shoulder you can do. Because these things you have ball and socket. Any ball and socket joint can do circumduction. So these two have ball and socket. Hip and shoulder have ball and socket joint. So you can do rotatory movements there. Then other than that, internal rotation. Internal is always inward and external is always outward. So internal rotation, in, out, exit, out. Okay, remember internal rotation and external rotation. You can do with the shoulder joint. And then you can also do flexion with your trunk. You can also do with the trunk region. You can do lateral flexion. You can do, lateral flexion. On either side, you can do right side lateral, left side lateral, and come back to the midline position. So side bending, right or left, is lateral flexion. You can do using your vertebrae. Then you can also see movements at the foot. You can bring it inwards, the sole facing inwards. Sole of the foot facing inwards is inversion. The sole of the foot is facing, sole is outwards. That's called aversion. And aversion is done only by the lateral compartment of leg muscles. Okay, remember, lateral compartment of leg muscles. So this one is dorsiflexion in this plantar. This is just like ballerina, ballet dancers, ballerina dancers. Like dancers, dorsiflexion is upward like this. So this is always when we drive the vehicle. We always keep our foot dorsiflexed when we drive. Remember the driving D for dorsiflexion. How do you keep your position is promise. This is facing the drive. When you put the brakes, that is dorsiflexion. Plantar, like a ballet dancer. Then you have movements at the wrist. At the wrist, what we can do? We can move it towards the thumb. Thumb side is radial side. Little finger side is ulnar side, ulnar deviation. So we have ulnar deviation, we have radial deviation. Ulnar is near the little finger. Radial is near the thumb side. What is opposition? Opposition is when you try to touch the thumb to the other polar surfaces. Now here there is 1, 2, 3, 4. When you start counting with your fingers, This is called opposition. Okay, when you count, always the thumb is the first one. Then comes the second, third, fourth, and the little finger is fifth. Okay, remember thumb is first one. Then this is the first one. Then this comes the second. This is the third. Then this is the fourth. The little finger is the fifth one. So this is how you will count. 1, 2, 3, 4. Many people, I have seen many people start from the fifth finger like this. Then they open this up. No, it's always the thumb first. Okay, thumb is the first one. And the thumb joint is known as first metacarpal joint. Where is carpal? Carpals are, these are all carpals. There are 4 plus 4. So this one articulating with the metacarpal joint. This is first carpo joint. You'll definitely see my upcoming tomorrow class. I have my name as Rohini Avadhani. So you please see this and you enroll for the class. And once you enroll, how do you do that? But you have to use the code. If you are first time user, definitely you need the code. It is Rohini 10. Okay, ROHINI 10. So once you use this unlock code, you will be bunch of flowers and crackers and whatnot. And that is your welcome to the Unacademy Learners platform. And once you are in, you are part of, you are going to get notifications about all the classes that are going to be held. So that is the reason we say you'll never miss a class because you will be notified. And at the end of the class, you will also get lecture notes in the form of PDF, which you can download. Is at all in your phone. So just go and do this right away. Plus class subscription. So remember, the special classes are absolute. So this is going to give you a glimpse, and iconic classes are going to be like a demo. So please access all the special classes and take whatever, important things in terms of knowledge you can take for free. Okay, so here we have 25,000 clinical questions you can access. And this is something that's really interesting. We have limited time offer. So here we have NEET PG iconic subscription. So usually we have this at 12 months. But here a new price. But if you use the code ROHINI, the final price 15% discount. So here it says Rohini 10, but it is more than 10% price, 30, 150 for 12 month subscription. Similarly, you can go for 18 months, 24, 40. So if you are in first year, you'll not just get the access of first year 19 subjects, so all the 19 subjects. Okay, so you are definitely good. You can download everything. You can definitely store everything and you are good to so neat and nice that you will definitely not fail in any of the subjects. So that is one, and it's not fun, right? You can go with the 12 months up 30,150. Okay, it's much, much better. That is the steps I mentioned to you. And that's how you check out our special classes. So these are some of our proud students who have been greatly benefited. And this is FMG, many more like this. Target next 2022, FMG 15th of September. You're going to see me also in these classes. And there are so many classes held parallelly. So you have all these fast-paced educators are going to catch up with you. So here is clinical examinations and procedures batch. The medical PG preparation, which the 4 free classes in the sense 4 months free. And 12 plus 2, that is 2 months free. So you'll get 14 months, more than a. And here she is become a pro in the subject and really, really master the subjects. And this is the NEET PG subscription. How do you do that? 48 months access will be 1406 per month. And this is 1125 per month. Okay, this is the EMI option that you can go for, but you need to use the HINI 10. Don't forget the code, otherwise you'll miss on the discount. I would like to end the class. Thank you so much for being wonderful listeners. You have understood the movements. I hope you'll not get confused. Remember, there is no extension at the ankle joint. There is only so inversion and aversion. Which joint does this? Think, think, think. There is dorsiflexion, plantar flexion. Which joint does this? I'm going to answer this. Goodly, any idea which joint does this? Which give you the answer itself? These two are done at the ankle joint. Okay, below the ankle, there is one more joint that is called the subtalar joint. You have heard of talus and calcaneus. That joint is called, this is talus calcaneus. And the ankle is by the tibia and talus. This is also called joint. Okay, this is all calcanean joint. So with this, and see you all again at 9 o'clock for next session on the quiz. So please don't forget to attend my quiz that is at 9 p.m. today. So see you all then on YouTube. Take care. Bye.